like to call this special called meeting to order this morning, just to give you all a little bit of information prior to going down the agenda. First of all, thank you for agreeing to meet today. I apologize that I've been out of town and back and forth, but I appreciate everyone being able to either Zoom or meet in person. How we're going to do today's meeting is, first I'm going to do roll call, and so this meeting will take a little bit more time than normally because there are people Zooming, so we'll do roll call first. Then it will be followed by an update. Jennifer, Karen, and then Dr. Linker, if he wishes to speak prior to discussion. So if you can hold your questions until after everybody's had a chance to present the information, I would appreciate that. And then when we go into discussion, those of you that are Zooming, if you put in the chat box that you have a question, I will address your question in the order in which they come. So saying that, let's move on to roll call. Amy Cole.
Here.
Anna Barrett Smith.
Here.
Benji Forrest.
Here.
Caroline Doherty.
Here.
Don Rhodes.
Present.
James Tripp.
Here.
Tracy Everett Lentz.
Here.
Worth Forbes.
Here.
Okay. All are present. We will move on to the update with Jennifer, starting first.
Good morning, board members. Good morning, everyone. We want to talk today a little bit about the mask survey that we did present on Friday. So Friday, we sent a survey directly to parents through phone and text, or through text and email, and that was open through yesterday. It was limited to one response on Google Forms. We did receive 9,862 responses, which is about 37% of our students and our staff members. If you want to look at the graphic there, we did have around 59. It ended yesterday at about 59.8% in favor of parent choice and about 40.2% in favor of masks as a requirement as outlined in the Strong Schools Toolkit. A special note, I did watch this survey every hour the first day that it came out, which is when we got most of the responses, and then every day, several times a day. And I will say that it hasn't varied very much by more than 5 points either way, between about 60% choice and about 40% masks. We also had about 2174 additional comments, so over 2,000 comments were received. We spent a lot of time looking at those and breaking down the most common comments and comparing. So I'm going to give you a summary of what those comments were based on our stakeholders, and again, this was sent to parents and to staff members. Okay, so first of all, it's important to note that we're not presenting any of this as fact. This is just a summary of the comments that were made by parents and our employees. So the first couple of comments, and again, I tried to put the similar comments in both columns. So the first for choice really was parents and employees should have the right to choose, and that we should not make that choice for them, and that parents should be able to make decisions for underage children, versus requiring masks for the health of the majority of individuals is morally and ethically right, and that we have to consider the safety of vulnerable others. It's not about preference, but about responsibility. On to the point that the mask mandate in NC will have been lifted. It said has been lifted, but will have been lifted as of the time that this survey was done, and that there's no need for masks in schools, and there's no difference in school and going to the grocery store. Versus, this is not the same thing as going to the grocery store in masks. Students and staff are exposed for hours in a closed setting. Others commonly said, for those in favor of choice, said kids really are not affected as much by the COVID vaccine, and they have the smallest number of infections, versus those that were in favor of mask requirements, commenting about the Delta variant, that it's highly contagious, that COVID numbers are rising again, the Lambda variant, and COVID is not over. Again, for choice, vaccinated staff members shouldn't have to wear masks, and they should be exempt if required if they are, again, or vaccinated. Versus talking about vaccination, those who are in favor of mask requirements, that less than 50% of Pitt County is fully vaccinated, and therefore those under 12 can't be vaccinated at this point, and so they are susceptible and left vulnerable. Again, on the column of choice, we had lots of people that said no scientific evidence that masks work, that we are working toward natural immunity, that masks are not healthy, they cause sickness, and it's ear infections, etc., other sicknesses. Versus those that were in favor of masks as a requirement, said scientific evidence does prove that masks work, that flu season and other strep and other sicknesses were much less last year, and pleading to listen to science medical professionals such as the CDC, Academy of Pediatrics, DHHS, and the ABC Collaborative. Just a few more. Again, these are a summary of those that were most repeated. So these are more than 1 or 2 comments. They're more like 5 to 10 to over that. Again, for the choice column, masks are a distraction and detrimental to learning. Kids with disabilities have low tolerance for masks and shouldn't have to wear them. It's hard to hear students or teach with a mask on. Versus those that wish masks to be a requirement. Masks don't impact students' ability to learn. No one is singled out by wearing a mask if made mandatory. It reduces conflict, potential bullying or teasing, and it's easier to enforce as a teacher if everyone has to wear a mask, and it would be difficult to enforce if they were not required. Okay? Again, for choice, there are long-term social and emotional effects due to mask wearing. Students are suffering emotionally and need that face-to-face interaction was a common comment. Another common comment for those for requirements, kids wear masks in school fine, kids are adaptable, kids are better at wearing masks than adults, and then peer pressure will keep kids who want to wear a mask from wearing them if there's a choice. As far as requirement, or as far as choice, encouraging vaccination instead. Encouraging good hygiene, hand washing, and all of those things should still be in place, but masks should not. Versus those who said they would like a requirement because kids can spread the virus to older family members, there are susceptible people at home, and that children and staff with medical conditions will be more protected if there is a mask requirement. Last two, very interesting, the difference here. Masks as a choice. If mandating masks, it will cause division in the system for employees and cause parents to pull children out of school. Versus very similar comments for those who wish for requiring masks, that it will cause mass confusion and dissension in our employees and our families, and parents and staff will leave PCS or go virtual if not masked, and teachers are uncomfortable teaching unmasked students. Finally, there was a plea for requirements on both sides, and so I've summarized those here. Those wishing for there to be a choice, wish for there to be a requirement for COVID vaccines instead, just like immunization requirements, requiring masks upon symptoms only, requiring masks during flu season only, require masks if the mortality or the sickness rate rises for K through 8 students, and require the proof of vaccination, versus those who wished there to be a mask requirement. Require masks because there's no virtual option for younger grades, and then requiring masks because the vaccinated can still carry, catch, and spread COVID-19 and the variants. And that concludes the data for the survey.
Okay, thank you. Karen, you're up next. Gina.
Good morning. I am just going to summarize some of the points from the latest toolkit that came out July 21st. And these are taken directly from the toolkit. I just screenshot it. You'll see some of them are a little bit blurry. It's a screenshot of the toolkit. And just to start off, this is on page 4 of the toolkit. They talked about that it's updated to align with CDC guidance, and you will note that that is a July 9th date there. And they changed the toolkit now to have strategies that should be implemented by schools, and they explained there that North Carolina DHHS strongly advises that school leaders adopt all strategies in the should sections, because if not implemented, they create conditions of high risk for COVID-19 exposure and spread. And then they have strategies that could be considered to be adopted that will just add layers of prevention and further reduce spread and exposure. And they really focus on 2 COVID-19 prevention strategies that are the most important for in-person learning. And they say that those are promoting vaccinations and proper and consistent use of face coverings. And so, again, still on page 4, they just talk about the summary of key updates, which is nice when they do that, because sometimes you have to go along through the toolkit. It's been revised quite a bit this year. And like the last revision, I finally asked my regional nurse consultant, what did you revise? And it was like language that was meaningless. But here they summarized them. So they did add information about, again, promoting vaccinations. They really stressed in-person learning and how that is important. And of course, we've been doing that all along, or at least offering that option. So, but they really talk about adding language there that say that in-person learning is the best, and that we need to make sure that the strategies don't reduce in-person learning. They did also update the guidance to align with guidance for fully vaccinated people. And again, we began doing some of that in late spring towards the end of the school year for our vaccinated staff, and then eventually our vaccinated students at the high school level. Some of them were able to not be quarantined because they were vaccinated. They added guidance on testing strategies that they're recommending, and I'll speak to that as well. They also added modified quarantine guidance for students after a close contact in which both people were wearing masks. Again, we'll talk about that. Then they just removed a lot of components of the toolkit that were remained regarding plans A, B, and C, again, because they're talking about everyone should be in person. They also removed reference to the remote learning requirement, so we're not required to offer that. And then other things that were removed, and some of these kind of removed towards the end of the year, and then others are just now removed. But limiting non-essential visitors has now been removed. We can get students and staff together in large groups. They can participate in field trips and assemblies this school year. We no longer have to keep them in small cohorts or change flow of traffic in schools. We don't have to wipe down students' personal items. They can begin to share items. Again, the research has found that there's very low transmission from sharing items. The daily symptom screening, again, that was removed in some of the guidance. I can't remember now if it was late May or June guidance, but we did not have to continue to do the daily screening in summer school this year. Enforcing social distancing on transportation was removed. And then again, the providing remote learning options during quarantine has also been removed. So again, the key points that they talked about, the 2 big measures were promoting vaccinations. And so that is on page 6 of the toolkit. And again, they just talk about the research and evidence about fully vaccinated individuals. Again, this was July 9th. But talking about that schools should promote that as choice for families and work with our health department and other local health partners to offer, opportunities or just encourage families to get their students and our staff also vaccinated. And then the other main measure that they talk about that is on page 8, again, following the guidance, the latest CDC guidance, and again, the toolkit was based on July 9th CDC guidance. They talk about masks, and it says that when teachers and staffs who are fully vaccinated consistently and correctly wear a mask, they protect others as well as themselves. They talk about the correct mask use, and at that time, the recommendation in this latest toolkit says that it is recommended for people who are not vaccinated while indoors, including students, teachers, and staff. And then again, because children under 12 don't currently have access to the vaccinations, it is expected that all students under 12 will continue to wear masks. And then outdoors, in general, people do not need to wear masks. And then during transportation, it does note that the CDC's order applies to all public transportation, including school buses, and it says regardless of mask policies at school, all passengers and drivers should wear a mask on school buses. So that was part of the cloth face coverings. That continues, again, with just the shoulds. We'll just highlight the shoulds, that it says that we should require children and staff in grades K-8 to wear face coverings consistently when indoors. And this says regardless of vaccination status, because again, most of the children in those grade levels are not yet eligible for vaccination. It reiterates the use of masks on school buses. And then it also says that we should ensure that face coverings are worn indoors by all individuals who are not fully vaccinated, including our students grades 9 through 12. Then the other measures in the toolkit that they talk about are the things that we, again, have been doing all throughout this past year now. Physical distancing and minimizing exposure. They still are recommending 3 feet, but they do have information in here talking about that in-person learning is very important. And so, if you can't minimize the 3 feet, that it's, again, important to have those layered prevention measures, the hand washing, the masks, staying home when you're sick. And then it also talks about mask use by people who are not fully vaccinated, being very important when physical distancing cannot be maintained. And they also are still recommending that for individuals who are not fully vaccinated, for teachers and students to be at least 6 feet apart. They also talk quite a bit, and this is on page 12, about testing. And they are recommending that schools participate in some type of testing, and they give a lot of options regarding testing, but they recommend in here that we offer antigen testing, and you can see there, they have a chart that talks about different scenarios where we would again offer, and I'd just like to stress the language offer antigen testing as a way to screen. And again, there are many options, and there's a lot of information that we've been sent about what we could do to participate in free testing. And then on page 13, they talk about the handling of any kind of suspected, presumptive, or confirmed cases. And again, this is the work that we've been doing since last school year with our nurses, nurse extenders, and our administrators and our school staff that are designated as COVID contacts. And a lot of that is the same as it's been, with a note at the bottom, and I drew an arrow to that. The note, again, this was based on July 9th guidance for the CDC, but they did put in a clause there that talks about, and I should have brought my glasses, but that CDC has said that if students are masked, that students that are masked when quarantined would not have to be, or when exposed, when they're masked when exposed, they would not have to be quarantined. And that is from the CDC and also the ABC Collaborative data that was done through Duke, which we participated in early on, and then when mandated, did also show that data, is that we were quarantining children and not seeing transmission. So if both individuals are masked, they would not have to quarantine. And that is, again, for students only, not for our staff. And then the last highlighted point would just be the transportation recommendations on page 19. And again, just things to help our students when on our public transportation or our school buses. Again, ensuring that everyone is wearing a mask, and then like opening windows if possible. Again, they recommend that, if you can spread kids out, you should, but again, that usually isn't possible, and we do want to get as many kids to school as possible. And that concludes the highlights. Again, there's much more detailed information in the toolkit if you like to read it as much as I do lately.
And now Dr. Linker, do you have anything you would like to add before we go into discussion?
Good morning, everyone. Just one thing. Carol, go to the next slide.
Okay.
You can see I've had lots of conversations with Dr. Silvernail, obviously, over the last 5 or 6 days since this came out. Carol, click on the that link there, please. If you would bring that chart up, go to this is just some data, just some of the same stuff that's on the dashboard, but Dr. Silvernail sent this to me. Go down to the third slide. That's the one before that. That slide. Zoom that in just a little bit. That's just a breakdown of the ages of people who have contacted COVID over the last about a little over a year and a couple months. And what it really shows is you can look back to last August, and basically you see the age groups there, but you can see when the ECU students came back there in August. You can see then Thanksgiving and Christmas, the big, massive spike we had there. Then you see another little bump right after spring break. And you kind of see another even smaller bump around just 2 weeks or so after the 4th of July. Obviously people traveling in the summer, people traveling at Christmas, Thanksgiving. This last bump, it does look like, hopefully it'll be a little bit smaller than the one at spring break, but so it's just there for you to look at, and you can see the yellow across the bottom represents kids from 0 to 17. So you can see where they are now. I went back and looked at the data from the last 2 weeks, okay? And then the last 2 weeks, there's been 39 cases of kids getting COVID between the ages of 5 and 17. According to the dashboard. And then also talking with Dr. Silvernail, we're right at 25% of students between the ages of 12 and 17 in Pitt County. So it's not just Pitt County students, it's all kids between 12 and 17 who have been vaccinated. So about a quarter of the kids, which is actually a pretty decent number compared to some of the other superintendents I've talked to. So that number's hopefully that number will continue to climb. Been asked numerous times about the percentage of staff, and I think I've said we're thinking we're close to 80%, just only because we had over 70% sign up, so we think about 70% signed up and had it done in May. We also know we had numerous people, or not said May, in March when we did the mass vaccinations, but we also had lots of people go and get vaccinated on their own since then. So we should be in the neighborhood of 80% of our staff. And we can, once we get back in school or get our principals communicating with their staff, we can certainly figure that out to get an exact number. So those are the two pieces of data I wanted to share with you that Dr. Silvernail had shared with me.
one thing before we go in discussion, I do want to make note, some of you probably know, but if you don't know, the CDC has changed their recommendations since the toolkit was put out, and so anything in the toolkit that says July 9th will change. I'm not, you could go on the website and see what their changes are. I'm not saying that's going to change the toolkit as far as what should and shouldn't happen, but just so everyone knows that the CDC, since this was put out, has changed. So things change quickly. And now we will go to discussion, and Anna Barrett.
So if I'm understanding this correctly, the toolkit is only reflecting previous CDC guidance. It's not reflecting the most up-to-date. So we can expect if history is repeated that the toolkit will be updated at some point, probably sooner rather than later. We don't know that, but we're working with, in my view, an outdated toolkit. So it's my understanding of this that the default, if we did nothing today, is that there is no mask requirement. There are suggestions, but not requirements. Is that accurate?
Beginning August 1st.
Beginning August
Correct.
1st, right. So the current configuration of the toolkit, so from my view of it, no action would be required if we wanted it to be optional. That's the default setting. So the only action would be if we wanted to create a mask mandate. And in looking at this, because we have historically followed the toolkit, and we don't have an updated toolkit, also just based on watching data, there's a lot of fluctuation in data. So, my position is, creating a mandate at this point without an updated toolkit is premature. Even considering a mandate is premature. We have 3 weeks until school starts. And so, to create a mandate that impacts over 20,000 people with ever-moving data and without an updated toolkit, even though I think we can think we know which direction things are going, is premature. So, I would move that we table any action towards a mandate until our work session and tack on a special called session 2 weeks from now, which is closer to the time school starts. We're more likely to have an updated toolkit. I am not saying, that we shouldn't make a mandate. We should make a mandate. What I'm saying is I think it's premature without an updated toolkit. So my motion would be that we table any action toward a mandate for 2 weeks until our work session, and that we would hold a special called work session in which we would presumably have more up-to-date data and potentially more up-to-date guidance in terms of the toolkit.
So Anna Barrett has made a motion that we table any action towards mandating
A mask mandate.
a mask mandate until our work session.
I'll second.
And Caroline has seconds it, so
Ma-
now we'll have discussion.
Madam Chair,
Yes, is that?
Madam Chair,
Yeah, is this Benji?
this is Benji Forrest.
Thank you. Go ahead.
Yes, parliamentary inquiry. I don't think you have a motion to table. I think Anna Barrett very eloquently explained the situation. We take no action at this meeting. There is no mask requirement.
Correct.
So there's no need to table anything because we don't have a motion to table. The only way you would table something is to put a motion before the board to table.
Okay, that's correct.
There's no business. I think.
So if
So
we take no, I guess what I'm saying is if we take no action, it does the same thing as Anna Barrett was explaining, except that I think it would be I think it would be contrary to parliamentary procedure to table something you don't have to table.
Okay, so if I withdraw that motion, I definitely am not, could I just say, express my opinion as a board member that I would like to see
Yes.
in 2 weeks, I would like to have updated county data provided as well as an update on
Yes.
the toolkit. Again, let me be clear, just as a board member, I am not saying that I am against masks. I'm not saying I'm pro. What I'm saying is we're 3 weeks out, and this is an ever-changing situation, and we're dealing with an outdated toolkit already. And so to make a decision of that magnitude that impacts so many people, I want to make sure that we are doing it with the most up-to-date information and guidance. So as a board member, I guess what I'm requesting, and you're right, Benji, a motion was probably not the appropriate way to do that, is to request that we receive further information.
And I think if the consensus.
Yeah, and Madam Chair, if I may follow up, it's kind of hard to tell if I'm interrupting anybody. If I am, I apologize.
Well,
But just to follow
ahead.
up with
Well,
that, I think we would be,
Actually, Emma's trying to speak, so could
So
you
if
let
I
her?
may, I was just gonna say, I think if the board is deciding to take no action at this point, you would just, if there is consensus of the body not to do so, and you don't hear any further motions from a board member, one way or the other, you could go ahead and adjourn this meeting, if that is the decision that you will be making.
3% of kids 17 and under.
What? I don't know.
well, that's true. But if I may, Madam Chairman,
Go ahead, Benji.
I would just say that we're always encouraged to receive information, as Anna Barrett said. So, and I'm certain we will continue to receive information, updated information every day. But I would be inclined to do the same thing. I would say with unanimous consent, we just, take no action.
Okay. I do have a question here. Tracy?
I have one question, and I think it's very sound judgment that Anna Barrett is articulating very well. But my only question is, how would we handle the early college situation? Because they begin, is it the 5th of August?
It's
And
my
so-
understanding that they are subject to whatever the rules of their particular
University.
campus is. Right now, PCC is requiring,
Okay.
so for that early college, I believe
And
ECU
ECU
is
as well.
also requiring. So they're the only two that start next week, and they're covered by their particular campus.
Okay.
May I add one other
Yes.
thing? In addition to the county data and an updated toolkit, I know that I appreciate Dr. Silvernail weighing in. What I would like, as county health director, is I'd like to hear his recommendation. Is his position that he stated an actual recommendation, or is it a position? And that may be splitting hairs, but it's important when we're making a decision that is a public health decision, which, we're an education board, so I would like to request that we go back to Dr. Silvernail and ask again for his recommendation.
Okay. So, before going forward, Anna Barrett's requesting Dr. Silvernail, which maybe we can have him Zoom in at our work session. Dr. Linker?
I will work with Dr. Silvernail. He's willing to come. He was not available today. That's all. But he is certainly willing to come to one of our meetings or Zoom into one of our meetings.
Okay.
Chair Fagundes, let me also say that I have talked with both principals Wednesday or Thursday or both days of last week at the early colleges, and they are working closely with obviously with PCC and ECU on exactly what they can and can't do and where they have to wear masks and when they're allowed not to wear masks, i.e. walking across campuses and things like that. So they're ready to go forward.
Okay. And just to make it clear, we didn't schedule this meeting and come in here this morning knowing that we were going to have a toolkit that was not updated. This happened yesterday where the CDC made the changes. The toolkit has not been updated, but it will, if nothing else, where the CDC information will change. And so I think it's wise, knowing that, today that that's going to happen, that we wait, we have time. Nothing has been mandated thus far, and then we can come and make a better decision at the work session with more information. So I guess should we vote to see if everybody's okay with that? Do we need to vote? Can we just ask if there's further questions or?
I think if there are other members of the body who wish to speak, I don't know if
Okay.
anyone else wishes to bring business before the board.
Does anybody else have any concerns, questions, comments?
I agree with what's been said.
I do have one question. It's not really related to what we're talking about, but it was related to the toolkit, so it's more for Karen. I had written down about the remote learning option was removed during quarantine was removed. So what's going to happen for those students who do get quarantined? Are they just out of school for 10 days? I mean,
Just like any time a child is sick, we would provide work, and I think now we have many more means to provide work, than we had in the past due to devices.
so they would still be able to
So,
keep up with their
Yeah.
work while they're out.
Yes, I
Okay.
think we would try to, that's one of the things that we were talking about, is just knowing that we will potentially have the students quarantined. And again, that could be more or less based on our recommendations.
Okay, Anna Barrett's got one more question.
Just one last question along that line. So I know that virtual has not been an option, and in one of the comments that Jennifer presented, it was that it was not an option for younger kids. I would like to get some information, if it's not ready today, that's fine, on what our flexibility is. Should there not be a mask mandate and there are people who want to enroll virtually because they're concerned about their child vulnerability? And/or, do we want to look at greater flexibility in that area, not offering a broad virtual learning, but can we look at what our flexibility is there to accommodate no matter what our decision is and offering some flexibility?
Melinda,
Yes.
this is Ethan.
Yes, go ahead, Dr.
Dr. Lasser and I, along with senior leadership, have had a conversation on those exact questions on how we're going to handle that. We do know we have Canvas and Seesaw available so kids can easily access information if they are quarantined at home. We also have the old school method of packets that we can do, and they always seem to work. We also know we may have to just expand some things as far as the quarantine situations and what our options are. We've talked to Dr. Lasser and I have had that conversation on what virtual may look like, depending on what comes out of the next couple weeks. But there's still the rule in place that there's a rule in place about the number of full virtual days you're allowed to have. So we're trying to read that law as well. But we're keeping that on the forefront so all the kids will get everything they can get.
Okay, any further comments?
I had a question.
Go ahead, Caroline.
Thank you. I just want to make sure, Karen, that I understood the change in the quarantining requirement, because so many of our children, were quarantined last year, sometimes whole classrooms. So the change is basically that if the students who were exposed or who were exposed, if the teacher knew that they were wearing their mask properly during the entire exposure. Let's say a kid comes to school with symptoms and turns out they're COVID positive, and let's say it's a K through 6 and under 12 classroom, so nobody's vaccinated. So as long as the students are wearing their properly fitting masks and wearing them properly, then they don't have to be quarantined at all. Is that correct?
Yes, that's the way I'm reading that.
Yes.
Correct.
Yeah, so that's really different. That's a huge change. That should help keep our kids in school, which I think that everybody can agree that keeping our kids in school is a priority in our school buildings with other students and teachers face to face. So thank you for that. That's a big change.
Anything else?
Madam Chair,
Yes, Benji, go ahead.
I just think that it's very, very important that before we turn the meeting off, that the public understands exactly by taking no action means that there is no mask requirement for students of Pitt County schools currently.
If I may, again, beginning August 1st.
Correct, beginning August 1st.
Right.
And we will
There
address.
is no mask requirement.
Right, because that's not required right now. And we'll see, I think there'll be more information coming out tomorrow, possibly. And we'll have a new toolkit and we'll go from there. And if we need to add a special called meeting onto our work session, depending on the information that comes down from above, we will do so. Okay?
Madam Chair? Madam Chair?
Just a second, Caroline. Tracy's asking something.
I just wanted to tag on that with the exception of early college, which is different. There are
Correct.
certain regulations that they have to go by with the university.
Correct. Go ahead, Caroline.
And
I got a
I think
question.
we're still in summer school. So I believe the mask mandate's required through the end of summer school, correct? Aren't we still in summer school?
Yeah, correct.
We're done, right?
Okay. So through the end of
Right,
this week?
Right, and August 1st
Is that the last day? Is
August
this
1st is Sunday, so.
Tomorrow is the last day.
Tomorrow. We didn't have to do a makeup day?
We did it last Friday.
It was last Friday.
Okay, thank you.
Yes, ma'am.
Okay.
I got a question.
Who's speaking? Mr. Forbes. Okay, go ahead, Worth.
Basically, it's a statement. I just think after our next work session, when we get new information, we need to go ahead and decide on which direction we're going to go in as a county, because parents need to know exactly what we plan to do as soon as possible. Some of them, depending on our decision, may make other arrangements in regards to education, educating their children. So we do need to be ready to make a decision, and that is what I feel like that we owe to parents. Okay.
Correct.
I would agree with that.
Okay, anything else? Hearing none? I need a motion to adjourn.
Second.
Okay, I had a first and a second, Aaron first. And we have to, all in favor, I'll have to do a roll call because we're doing Zoom. Amy Cole,
Yes.
Anna Barrett Smith,
Yes.
Benji Forrest,
Yes.
Caroline Dougherty,
Yes.
Don Rhodes,
Yes.
James Tripp,
Yes.
Tracy Everett Lentz,
Yes.
Worth Forbes.
Yes.
This meeting is adjourned.